I was drawn to medicine because it combines the science and the human aspects of health. Health to me is more than treating an illness. It's about supporting a patient in their life, their well-being, and their goals. Family practice was a natural fit for me because it takes a holistic approach and it allows for meaningful relationships to build over time. Integrative medicine was a natural extension of that because it helps me better support patients in not only managing a condition, but also preventing it and feeling better in their daily lives. Integrative medicine combines both Western medicine and other non-traditional modalities in treating a patient, such as nutrition, herbal medicine, OMT, and some other Eastern therapies. When I approach a patient, I take into consideration both the medical and personal context. So what a patient may be looking for in terms of treatment from either a Western or an integrative perspective, and create a plan that meets patients where they are in their lives. So that may be treating a patient with a medication or lifestyle guidance or a hands-on procedure. The most rewarding part about my work is co-creating a path to healing with my patients and then seeing them grow and reach their goals over time.